got a laptop, I've got an independent keyboard and mouse. When I first started working from home, I found myself quite hunched over the keyboard the laptop that I was working on, which wasn't very good for my back. So I built myself a little platform that sort of keeps my my screen elevated and puts me in a better position.
I work at home, my wife also works from home for most of the week, so our son had to be at home. So he, at the time that lockdown started, just turned 1. Obviously nursery closed, he had to stay with us. So trying to fit 2 full-time jobs around childcare from something like 5:30 in the morning to 7 o'clock at night was definitely pretty challenging.
I've been going into the office about 1 day per week, and the rest of the week I've been working from home. I live with 2 other people in quite a small flat, so we all work from the same table.
I live with 3 flatmates. I'm basically like the nomad who just wanders around and works in all kinds of different places.
Not having to do the commute in the morning, getting a bit longer in bed, not having to worry as much about the weather and what you wear and things like that has all been really positive.
I have more time for exercise. On the negative side, I would say I am less good at taking like a proper break.
Work, sleep, repeat, I think.
People have also said that they're like not working from home, but they're living from work, because it's quite impossible to switch off.
Motivation and not being surrounded by colleagues is quite difficult. Like working on your own at home, it can be a bit isolating.
I'd say generally it's been good for my mental health, but worse for my physical health. I am getting finger cramps and wrist aches, where I would say that I don't have a real correct setup. My ideal setup would be to work from the office a couple of days a week.
Having office and having that social interaction is important, but I think, a better balance, perhaps 2 days working from home, 3 days in the office, or vice versa, would be beneficial for lots of people, not just me.
I do want to continue working from home, but not 5 days a week.
I think a mixed approach would be the ideal.
With the COVID-19 pandemic, the emergency response from the UK government, of course, was that we should all work from home where possible. And here we are trying to do that as best that we can. Now, 6 months in, and we're still working from home. So one would assume the emergency phase now is becoming more and more permanent, and in which case a full DSE assessment would take place.